a little bit about yourself and your background, please?
Yes, my name is Dr. Mansoor Ahmed. I am a graduate of King Edward Medical College. Did my subsequent training at McGill University of Toronto and Winnipeg. I specialize in internal medicine, pulmonary critical care, but most of my career has been spent in sleep medicine. And my passion for sleep medicine actually was nurtured by Dr. Mayor Krieger, one of the pioneering figure in sleep medicine in Winnipeg. And then subsequently, I came to United States at Case Western University, worked at in academia for 10 years, and then established my own sleep program, which included the clinical program, clinical research trials, and education. So the moment I am working in Pakistan to on this specialty, which is very much underserved, and myself, along with my colleague, my class fellow, Dr. General Kiani, who has been a pioneering leader in the cardiovascular disease in Pakistan. And our team also includes psychiatrists that who are trained, educated, and worked in the United States. Now they are with me to promote and improve mental health, sleep, and drug rehab. So that is the background.
Okay, so can you tell me a little bit about how you think AI will impact mental health, just generally, into artificial intelligence, like how you think it's going to
The
make
two
it?
aspects of this thing is, yes, sure. I think one is that it takes a tremendously, I think, a tremendous amount of time for to I think to intake patient intake and subsequent synthesis of what the patient problem is, the assessment and the subsequent plan, and particularly in the psychiatry and mental health, the narrative is quite long, as you very well know. I think as compared to I think general medicine, where you have a relatively simple, straightforward, I think one paragraph, half a page, I think synthesis. Mental health is a tough, not only in the term of the questionnaire that you have to put over there, the scales, and then the patient narrative. And by the time you are done, it's usually, I think, it takes like 45 minutes an hour for the initial assessment and the plan of the patient. So that is one thing that will help in, I think, decreasing your time to write down the notes. I think taking improve your efficiency. The second, which I think, which is very, very important, because there's so much of it's a tough diagnosis. The underlying secondary conditions, underlying other conditions, particularly when it comes to the sleep, and which is part of the mental health. There are many competing factors which are essentially causing the patient same symptoms. For example, I can talk about insomnia. Every patient insomnia more or less have the same symptoms: difficulty falling asleep, staying asleep, waking up frequently, waking up tired. But they're close to God knows how many underlying conditions, both psychiatric, non-psychiatric, medical condition, circadian rhythm, are contributing to that insomnia symptoms. So that is very difficult. That the most difficult challenge in the chronic insomnia is the patient evaluation, because it is really, I think, it is experience based. People don't have the time to ask, like to take 2 hours, 3 hours in evaluation. But I believe that having the AI, which can synthesize, can narrow your diagnostic field, I think, into 2 or 3 major areas, and you can focus on that one. So one is decreasing the time of patient intake and your subsequent note. Second thing is that by feeding those questionnaires and your intake to the AI, it can help you in reaching the diagnosis in a relatively shorter time and can focus over there. So both from the practical, and then second thing from the diagnostic perspective, I think that is the hypothesis yet to be tested. That can we ask our note intake and have it AI analyze and come back with some sort of some basic understanding of why the person have insomnia, and that can make the foundation of your assessment of that insomnia of that particular patient. And then of course the plan. I think rather than me basically treating all the time sleep hygiene, cognitive behavior therapy, I think the AI can create some sort of a framework, a therapeutic framework. What are the possibilities, what are the best options for this patient? So there is a role there. And then, of course, the voice is a very powerful, I think, analysis of the voice is used now alone. I think in patient, depression, or patient have schizophrenia, as you know, that the voice has been used by Dr. Singh. I think it's in what's that university name? I'm forgetting it, in Pittsburgh, I think the institution that she used the language, that talking, how you speak and how you talk, basically, to evaluate your PTSD and have established diagnosis for your mental health disorder. So voice analyze basically software have been used to diagnose or to at least to screen the patient for underlying mental health conditions.
Excellent. Thank you so much for giving your time.